This is Jeffrey Tucker, Brownstone Institute. I was looking through some of the new data on labor, the new jobs report today from the Bureau of Labor Statistics, and I'm telling you, there's one figure here in this jobs data that I've been following ever since the calamity of lockdowns, which is labor participation. Labor participation would seem to indicate how much people are, I don't know, thrilled about doing the thing nobody wants to do, which is to toil, go to an office, earn a salary, earn a wage, work under an annoying boss, work with annoying colleagues, to do all the sort of terrible things that life requires you to do, but you do it because it's part of the liturgy of life. And I don't know, that's what we do. We work, right? But then the lockdowns just invited us to think about life in a different way. It just said, don't worry about it. Just stay home, stay safe, crawl under your sofa, and we're going to send you money. Strange world. The money arrived automatically. We didn't have to do anything. We were richer than ever, and yet didn't have to work at all. We just could luxuriate and watch movies. Well, there was something about this that can't have been good for the human spirit. And I worried about this. How are we going to stop this? Well, this went on months, and then ultimately, 2 years and longer. And I wondered how much has been shattered as a result of this. So I've been watching these labor participation figures. Of course, they collapsed completely initially with the lockdowns to shocking levels. That was the point, right? Not just flatten the curve of the microbial kingdom, but also flatten the willingness of people to work. That was the idea. But it never really came back. It bounced up a little bit, but it's been declining ever since. And the latest report shows that it's falling at dramatic levels for all populations. But in particular, we're seeing, I noticed two demographic massive changes. One is on the number of working women professionals is in a dramatic state of free fall, for a variety of reasons that we don't need to go into here, but I think that women in particular were affected by lockdowns for reasons of demographics, division of labor in the household and otherwise. But the other figure that shocks me is that after 55 figure. Anybody older than 55 is now, we're at the lowest levels that we've seen since, I can't put a date on it, but it's a long time. For the women, we're back down to 1988 levels. For the under 55, I'm not sure what the low figure is, but it's as low as it was, almost as low as it was during lockdowns. Now, immediately when you start citing these figures, people start talking about the why of it all. And I think some of it has to do with that shattering of the rituals of life. Never really came back. The lockdowns invited us to think we inhabit a fake world. Nothing around us is real, and so why should we participate? That's affected millions of people. You've also got a problem of the way that inflation has created this kind of roller coaster or sort of hamster wheel feeling that no matter what you do, you can't get ahead. Wages are not keeping up with the inflation or the decline in the purchasing power of the dollar. There's another factor too. Once you overlay this work ethic problem or the labor participation problem with the disability statistics, we're seeing them just skyrocket, which speaks to a larger issue of ill health in the population. And when I'm saying ill health, I mean mental. You might have noticed there is a problem out there with people just kind of going a little bit nuts. People are not behaving the way they used to. Unexpected mood swings, strange utterances. You've got a whole generation denied 2 years of education. Gen Z is strangely unsocialized, as far as I can tell. Unable to look at you in the eye, always assuming that the systems around them are conspiring against them. They're probably right about that. So they've learned to sort of live a double life, a whole generation. Very odd. So there's the mental ill health and demoralization of the population that is affecting these statistics, but actually a genuine physical ill health, which, I'm going to say what nobody in the national media is willing to say, because you will never see the V word mentioned in any of these articles about the ill health of the American population. But the V word is, of course, vaccine. The COVID shot turns out to be vastly more dangerous than they ever warned us about. Fauci every day said there's very, very rare side effects, but come on. This was a devastating shot with demonstrability connections to the rise of cancer, unprecedented death, and infertility, and just ill health in general. Well, one of my partners at Brownstone Institute, with whom I speak about these issues and more, is Dr. Toby Rogers, who's become just a really important intellectual colleague to me in helping us understand the strangeness of our times. And he's been a person who's uniquely been willing to say, look, these COVID shots follow in a long tradition of ill health that is related to the vaccine industry. And part of that speaks to an explanation for the autism epidemic, which should be obvious to you. It is very obvious to me. It's the most heartbreaking thing you can possibly even imagine. I see it every day. Toby has been very brave about calling this out, and it's gotten him into a lot of trouble. But I don't think that there's a greater expert on this topic available. So to address this topic and others related to what I'm calling the sort of great demoralization or ill health of the American population, I'm very happy to welcome Toby Rogers. So happy to have you here, Toby. Thank you.
Well, thank you, Jeffrey. Thanks for having me. Can I just jump right in? Because
just go for it.
You said so many interesting things already in the intro. So when I look at declining labor force participation, I can highlight 4 factors. Now, people can come up with more than that, but let's start with 4. So you have the 1986 National Childhood Vaccine Injury Act. So starting in 1986, the vaccine schedule in the United States explodes. You have the hepatitis B vaccine added to the childhood schedule. And then with liability protection, the pharmaceutical industry adds heaps more shots to the schedule. So you go from sort of about 8 shots to 72 today. And so you have an entire generation, and I think we can call it the 1986 generation, for whom disability rates are much higher, 3% autism rates, but there's other disabilities in there as well. So you have this entire cohort that never joins the workforce in the first place when they hit adulthood, right? So these are cumulative impacts that we're seeing. Then with the Clinton administration in the 1990s, you have NAFTA and you have the World Trade Organization. So you have the entry of China into the global trading scheme, and you have Canada and Mexico having free trade with the US. And so 10 million manufacturing jobs move out of the US. And what happens in these towns where they're deindustrialized, that no longer have factories, that no longer have work for men, what you see is disability rates go way, way up, particularly in the male population. And you see pain as the disability that people apply for and receive disability for. The pharmaceutical industry takes advantage of that, floods these Rust Belt towns with opioids. That's where we get the opioid epidemic. And now you have the opioid epidemic killing 60, 70, 80,000 Americans every year. So that's declining workforce participation. Then there's COVID, where the federal government just said, nope, stay home, don't work. We're just going to turn off the entire global economy for who knows how long. And that, as you pointed out, changes workforce patterns for Generation Z, for everybody. And a lot of those jobs never return. Small businesses are wiped out. 1 million small businesses are wiped out. So you get declining workforce participation there. And then with, 70, 80% of the population receiving these COVID shots that are toxic, that cause myocarditis, rapid onset cancers, aggressive dementia, all sorts of health issues, you see declining workforce participation as well as disability rates go up. And we see this in the data. So it's just one assault after another upon the American people, upon the workforce. And so we reach the point today where 1 in 3 men are not in the workforce. And these numbers aren't going to get better anytime soon. So it's just wave upon wave of catastrophe of assaulting the American people, the American worker, of sending our jobs overseas, and then just straight up poisoning the population. But as you and I have discussed quite a bit, this is a strategy, right? This is an economic strategy. So we have the decline of the American empire. You have the ruling class looking for ways to keep their wealth growing. And they're like, hey, let's just exploit the American people. Let's just steal all the wealth from the middle class. And the way that they do that is through iatrogenic injury, through poisoning us through vaccines, COVID shots, statins, SSRIs, and all the rest. And through injury caused by medications and doctors and the hospital system and the pharmaceutical industry, they're actually extracting wealth from the middle class to enrich the ruling class. So they used to get rich through our labor in the factories. That's not how our economy works anymore. Our economy now works through iatrogenic injury, through the elites exploiting the middle class and stripping our wealth through iatrogenic injury. It is perhaps the largest economic shift we have seen in hundreds of years.
I think you've called it biological colonialism.
Correct. That's my preferred term for that, biological colonialism.
Yeah, and first time we said it, it was one of those moments where I thought, I've never heard that before, but before I rule it out, I'm going to think about it. And I've never stopped thinking about it. It's because it does seem to be very powerful when you drive through the typical New England city now. All the largest buildings and the biggest corporations are all somehow related to medical services, and they're forever hiring the insurance companies, the hospitals, and all the endless intermediaries that stand somewhere between the patient and the services that it receives. Meanwhile, we've got the strangest thing happening with American health insurance. It's like, as we speak right now, in an advanced state of collapse. I mean, we've seen already some 3 million people leave the exchanges this year, and it's forecast to be 5 million by the end of the year, because it's absurd. Well, like, why would you pay $1,000 or more dollars, or sometimes several thousands of dollars if you've got a family, per month for services you don't use? And then when you use them, you get dinged all the way up to what they call your deductible. Don't you love these absurd names they call things? Your deductible, which is to say what you have to pay for services rendered. And that even those figures disguise the problem, because there's many other people who get their health care through their jobs, their health insurance through their jobs, which the companies are forced to provide it if you have more than 50 employees. And there's no exit for those people. In fact, under the present system, if you make a deal to exit, you can only make that contract with your employer on the condition that you go to the exchanges. So they've got you boxed in all directions here.
Yeah. And Democrats spent 70 years trying to increase access to healthcare. The problem with that is they never asked access to what healthcare are we accessing? And what we see now is we have this vast, elaborate, expensive, complicated system that doesn't actually increase well-being of people, right? So allopathic medicine has become predatory. And so now the government just funnels people into a predatory system, and the system can't wait to recommend some sort of preventive care that causes harm. And then once it causes harm, well, the profits go up and up and up from there, because now you're stuck in the system. You're dependent. You're enslaved by the system. And no one would have drawn up this system. And what, we're supposed to keep throwing more money at it to save a system that nobody wants to participate in? It's madness.
It's perverse, right? Because the system makes more money the sicker you are, which is not how you would map it out if you were designing something from scratch, right?
Right.
You shouldn't be able to get richer from failure, right? It should be the opposite.
Right. And the insurance middleman just marks up the total cost by 15%, and that's their profit. And so they want the total cost of the system to keep going up and up, because that's where their profits come from. And that's what we got. We've got a system that makes people sicker and sicker. And the sicker people get, the larger the 15% markup is on the total. And it's no wonder that everybody's sick and miserable right now.
Yeah. And so I'm just imagining somebody listening to this for the very first time. And if you could pick them up off the floor after hearing what you just said, the question I always ask myself is, how come sometimes it seems like we're the only ones talking about this? I mean, the crisis is so huge and so obvious and screaming through every bit of data you could ever look at. And yet, I just don't believe there's a genuine sort of public consciousness about this. Certainly, you don't really read anything remotely like what you said in the national press.
What the pharmaceutical hospital industrial complex was smart to do was to buy up everything and everybody, right? They bought up the mainstream media, CNN, MSNBC, ABC, NBC, Fox. All of them are taking huge amounts of money from the pharmaceutical industry. And they bought up the political system, so politicians won't ask questions. They bought up the regulators, so regulators won't ask questions. They bought up continuing medical education, so doctors are just trained by the pharmaceutical industry in the latest products that they want to sell. They've bought up universities, the curriculum for medical schools. What I talk about in my work is what's called epistemic capture. So epistemology is the branch of philosophy that deals with how do we know something to be true? And it turns out it's actually a pretty complicated question. And what the pharmaceutical industry has done is they bought up every step in the knowledge production process in science and medicine in the United States. So people are always in an information bubble created by the pharmaceutical industry. And so they don't realize that there's a truth outside of that. And indeed, the best scientific breakthroughs always come from outside the system rather than from inside the system. And that's the crisis they're in right now. The pharmaceutical industry has captured the knowledge production process. And so people don't realize that they're in an entire system designed to enrich the pharmaceutical industry at our expense.
Yeah, and this profoundly affects people's careers who are tasked with doing serious research. We have a couple of friends of Brownstone Institute who wrote a paper for OncoTarget linking COVID vaccination with associated with the rise in cancer rates, and the server was hit with DDoS attacks. And the lead author of the paper was fired from his position as head of a cancer research institute at Brown University. He's under assault like never before, as his co-author. They're trying to make an example of these two. Do not say these kinds of things. So you've got a problem that the journals are all corrupted as well, and needless to say that profoundly affects academia. An industry we created sometime in the high Middle Ages to tell us what was true, right? And now it's just kind of a ruling class propaganda mill to say what you can say and nothing else, lest your career is shattered.
Yeah, so we've moved from a Cold War against the Soviet Union that ends in 1991 into a war on terror, and now into this silent war where the ruling class is at war against the middle class throughout the developed world, because that's where the money is. And it's this silent war where it happens through these small details every day. But the other side is very sophisticated about how they go about trying to dry up any information that hurts their profits. So they, in the early days of the Biden administration, there was this assault from the White House upon 12 medical freedom leaders that they called the Disinformation Dozen. Well, what the pharmaceutical industry had done, and used the Biden administration as their minions to carry it out, was figure out the 12 best funded organizations in the medical freedom movement. And through targeting these people, they were trying to dry up their money. They were trying to cut off their supply lines of resources to be able to get the message out. Then waves upon waves of censorship. But the censorship continues today. So the pharmaceutical industry is going one by one through the very best papers on vaccine injury, on the COVID crisis, on gain of function research, and they're just retracting them one by one. The scientific and medical journals in this country and in Europe as well, they've completely collapsed into just absurd demagoguery. And they're not actually doing science and medicine anymore. It's just they're doing the bidding of the pharmaceutical industry. It's hard to overstate the size of this crisis when you have the entire scientific and medical establishment, the mainstream establishment in the United States, doing the bidding of industry, not doing right, proper scientific work, and not doing work on behalf of the American people. That's an enormous crisis. It is such a failure intellectually, morally, politically of our system. And the result is just carnage. The result is people dying every day from the COVID shots. But you can't talk about that publicly without being cast aside, cast into exile, blacklisted, removed from journals, removed from universities. We are in the midst of an unprecedented intellectual and moral crisis in this country as a result of the meddling of the pharmaceutical industry.
Speaking of which, so I was just at what I think was just a remarkable meeting. Maybe you can help interpret this for me, because I don't entirely understand what to make of it. But there's this lovely organization called Feds for Freedom. And I spoke there just a couple of days ago at their conference in Washington, D.C., where they have all these people speaking on behalf of employees of the federal government who were subjected to these vaccine mandates, and they tried to resist them. And so these people themselves were subject to exactly this sort of biological colonialism. So, by the pharmaceutical companies. But at the very beginning of the conference, the president of the organization announced that they had filed suit against the CIA because the CIA and some of the speakers there were working for the CIA. But the CIA was subjected to these vaccine mandates, and the people who resisted the vaccine mandates were investigated by the CIA as being like for espionage or enemies of the people, right? So that's what the lawsuit is about. It's about against the CIA for having targeted refuseniks for the shots within their own ranks to get them purged, to have them deprecated or otherwise diminish their influence or silence them or drive them out. So now here's the big picture as far as I see it. Like, we're always interested to know what is the real power in society? Where is the center? What is the most powerful thing out there? And you might immediately say, oh, well, it's the CIA. Well, who was imposing mandates on whom? This is the big pharma was able to impose its will on the CIA and then provoke the CIA into investigating its own people who resisted the vaccinations. I mean, what does that tell you about where power rests within the system?
It is confounding. It does complicate our narrative quite a bit, right? So we've spent the last 6 years trying to figure out who they is. Who's the they that designed a weaponized virus, somehow contracted it out to Wuhan, somehow it got out and infected people, and who's the they that developed a new vaccine within 24 hours and then put it into production before the testing was finished? Who's the they that can impose mandates on everybody, the military, injuring countless soldiers, impose it on the CIA? So we had this theory of the case that the they was some sort of supranational group, ruling class, old money, CIA, NSA, intelligence agencies, some sort of
NATO,
NATO, Bill and Melinda Gates Foundation,
yeah.
Wellcome Trust, pharmaceutical industry, some sort of cabal along those lines. And yet, if the CIA is poisoning their own people, that complicates the narrative. Is the CIA driving this, or are they a victim of this? We still don't know who the answer to who is they. And this should be figure outable in about 10 minutes. And we've been working on this for 6 years, and we still don't have the answer. It is profoundly strange. Now, there are those who put forward the argument, and I've been persuaded by this in the past, that there is no they. It's just a series of structural incentives. People are responding to structural incentives in ways that lead to these perverse outcomes that nobody would have wanted. But if that was the case, then when harm starts showing up, you would think that people would change course. The CIA would change course, the federal government, the military would change course when they see their soldiers, their employees being hurt, and they don't change course. So we don't have the answer. And I don't know which is scarier. If, a secretive cabal of they meeting, somewhere in some castle in Europe, or no they, and just a bunch of people responding to structural incentives and no off switch to this entire catastrophic system that's causing so much harm.
So I'm glad you said this. We're all, I think, shocked at how much our understanding of the world has changed over the last 6 years. Probably mine more than yours in a sense, although I can't say for sure. But the single most shocking thing to me out of the whole COVID period, now that you put it that way, was so when the plan was initially deployed, let's just say March 13th, 2020, and the document pan-cap adapted became our new GOS plan, right? And here's how we're going to deal with the infectious disease. We're all going to hide from it and close all the businesses and pay you money to stay home and work on a shot and all these things. So the whole thing struck me as so preposterous. I knew for a fact they'd been working on this plan since about 2005, at least, maybe earlier, but certainly since 2005. The whole thing was so absurd. I thought for sure, like I consoled myself when this was unfolding. I thought, well, they say wait 2 weeks. Yeah, in 2 weeks, people are going to wise up. There's going to be a coming to our senses in 2 weeks. What were we thinking? Businesses are being destroyed. People are so unhappy. This is not improving the situation. This lockdown methods, which were always controversial, even from the time they were first proposed in 2005. Will seem to be a huge failure, and you will see the system reverse itself, and there'll be apologies all around, right? And I thought for sure this was going to happen in 2 weeks. So when it went on months, and then, lasted all the way to the end of the year, and then went on another year, and even another year after that, I realized I had sort of there's something I did not understand about the system. Now, you could say this traces to pride. Of course, nobody's willing to admit they made a mistake. People are much less willing to say, I'm sorry about anything in life. So maybe it's just the same sort of thing. But your explanation is actually a little more, for using Occam's razor. No, the reason it didn't stop and the reason there was no reversals is that the people who wanted to benefit from it were benefiting from it, which is this parasitical pharmaceutical class that was making yet another more inroads into human biology to sicken us and get us even more dependent, to strip mine the workers even more of whatever wealth and liberty and sense of volition they had remaining. And that explanation is so dark and so difficult, but it's the one that seems to account for most of what we've seen.
Yeah, that's part of the problem here is the size of the crime is so enormous. Millions of people involved in the crime as accessories, and harms just through the roof. One can make a case that there were over 1 million preventable deaths during COVID in the United States, so worse than any war that we've ever fought. So the architects of the COVID disaster killed more Americans than the Nazis did in World War II. And so the size of the evil that we're dealing with is enormous, and that's emotionally difficult for people to wrap their head around, right? How can it be that we thought we lived in, an imperfect system, but there was some decency, surely. And now suddenly we're grappling with evil that looks a lot like some of the evils we saw in World War II. And America prides itself on liberty and freedom and being a republic and that sort of thing. And now we have to ask the question as to whether, fascism has emerged on our shores, and yet nobody's wearing a brown shirt and waving that flag. So so you have this grand conspiracy, but nobody owning it, nobody stepping forward to say, yeah, that was my plan. You don't have the racial hatred, the just insane nationalism and racial and religious hatred that you saw in World War II. So it's this catastrophe without an ideology, really, without a sort of guiding fascist ideology behind it. And yet it's instantaneous, global, incredibly well coordinated. You and I know, prior to COVID, government couldn't organize its way out of a wet paper bag. The notion of government quickly executing a plan in 24 hours globally was preposterous. Government didn't know how to do that. And suddenly government is now implementing the same policy across 40, 50 nations all on the same day, and with ruthless efficiency and sorting
and censorship, right?
Yes.
Remarkable.
Right. The largest censorship campaign in American history, worse than McCarthyism. I was kicked off of Twitter in the early days of the Biden administration, permanent lifetime ban for a single retweet about how Tony Fauci had blocked access to the antibiotic Bactrim during the AIDS epidemic. That earned me a lifetime ban on Twitter. Now, thankfully, Elon Musk bought the property and restored my account eventually. But government has never had this level of sophistication before. So if it's not some grand conspiracy, how did government suddenly learn how to execute this effectively? These things are very difficult to explain. We've been trying to explain it for 6 years, and it still leaves us scratching our heads. At least leaves me scratching my head.
Right. At the conference this weekend, I mentioned what I just spoke about, this PANCAP adapted plan that was passed March 13th, 2020, and it was released by the New York Times, about 4 weeks later, and it's still, this PANCAP adapted has still not been posted on any government website, which is the strangest thing. But there are about 15 other pandemic plans that are posted, and they all hint in the direction of what actually happened. And as far as we know, this plan is the closest thing we have to a documentation of here's what we're going to do, kind of documentation, which was essentially lock down until vaccinate, control the narrative, censor the opponents, get rid of any alternatives other than the pharmaceutical product that they created, the mRNA technology, get rid of every other option, preserve immunological naivety as much as we possibly can so that we can have mass inoculation of the public as a kind of an experiment. I mean, that's all implied in the document, maybe not laid out as clearly as I said, but that's what it is. And that's what I was told. I got a call from, I think you know this, but I got a call very early on from one of the pandemic planners who told me that was the plan, and I thought he was a loon and hung up the phone. I didn't actually believe him. But yeah, no, the efficiency with which they did this, and that also it accounts for their sort of their lack of contrition. Right? And this has been driving us crazy. How come we haven't seen any real coming to terms with what happened? Well, the reason is that the plan worked exactly as it was supposed to work.
And it was bipartisan. Both parties were involved. I mean, the last year of Trump's first term was a disaster. And then the Biden administration jumped in with both feet and said, how can we make it worse? And they made it significantly worse. And then Trump comes back into power now with supposedly a plan to make things better, and yet COVID shots haven't been pulled from the market. But Jeffrey, let's complicate this even a little bit more, because you and I know there's government reports all the time. There's a 1,000 government reports every year that come out. They just gather dust on the shelves. Nobody reads government reports, right? They're make work, they're busy work to keep bureaucrats busy. And somehow there's this one document that they actually follow and they actually listen to and they implement with ruthless efficiency. And you can somehow get access to it if you know where to look. So this secret evil plan written down, but nobody follows government reports. And now suddenly everybody follows this report. Now look, you can make another counter argument, which is, well, they've been doing pandemic planning exercises, and the CIA does these pandemic planning exercises. Bill and Melinda Gates Foundation and others participate in that they've really been gearing up for this for a while. So it wasn't one report. It was one report plus a lot of practice. But even then, it's so strange. And yeah, and then as you point out, the lack of contrition. So then when the plan goes terribly and kills at least 1 million Americans, probably at least 17 million people throughout the developed world, nobody says, oh, we need a new plan, we need a better plan, we're not going to do that anymore. No, they're still full steam ahead with these preposterous plans. How is it that logic and reason has completely disappeared from the public square? How'd that happen? How do we live in a world where Brownstone Institute engages in a very public debate about guided by logic and reason? Government doesn't engage in logic and reason. Mainstream media doesn't engage in logic and reason. The science and medical community completely abandon logic and reason. How did we get here? It's too weird to explain using the conventional techniques that we have in the social sciences.
And we're right now in a very interesting period, because many of the strongest dissidents from 2020 are now among whom Jay Bhattacharya and Robert F. Kennedy and so on, and a lot of lot of our friends from this period over the last several years are now in positions, mm, ostensibly of what they call power, but what we've learned from watching this stuff at sort of a granular level is that their power and maneuverability within these structures is gravely limited, to the point that they're probably just like losing their minds. But I don't think it's even fair to say these people are in power at all. And so, yeah, the reform that we hoped for is just simply not happening. Or if it is happening, it's so, so much on the margin that you have a hard time celebrating any single aspect of it. Or if you do, it's just sort of absurd in light of the larger problem. That we've still got mRNA technology just marching forward. We've got the FDA approving further uses of this stuff, just like on a daily basis. We've got just countless things. Things have slowed down a little bit, maybe, but you've not seen a kind of wholesale reversal, which further raises a question, that fundamental question: who is actually in charge of this thing? We were invited to believe in the old days that you elect a president, he makes appointments to the major bureaucracies, they change the policies, and the system adapts, but not in this case.
Yeah, you and I spend a lot of time thinking about politics and economics, and I was a firm believer in the notion that if we had a sea change election, we would get changes in policy, changes in law. And we had a sea change election, and the changes in policy and law are minuscule. And at least in Trump's second term, pesticides are being approved at a record pace.
That's true.
Regulations of coal-fired power plants have decreased, so you're going to get more mercury in the water, in the air, and the soil. And then the hope for reforms from MAHA, and as far as limiting the power of the pharmaceutical industry and doing things like banning pharmaceutical ads on TV and shrinking the schedule, we're not there yet. It doesn't appear that that's going to happen anytime soon. So we're told to, keep the faith, trust the plan, deliver our votes once again in the midterm elections. But I'm despairing of the electoral path for the first time in my life. I genuinely believe in the power of presidential elections in particular to enable this country to change course. And it doesn't appear that there's no one on the horizon who appears to have the power to implement the changes needed to save the republic at this point. So I'm at the point, and this isn't my style, so it's big learning curve for me of saying, well, is it time to exit the system? Is it time to buy a piece of land out in a rural area?
Well, and that's fine for let's say you do it. You're not going to do that, but let's just say you do it, and I do it. It's a weird aspiration, because I think you and I both got into this sort of business of thinking about big picture questions, not with the goal of saving a tiny remnant, but with the goal of finding the best path towards a healthy functioning society. And if this is the solution, to go live with the Amish, that is that's not exactly what we originally imagined, right? There's another factor here too, and you and I talk about this stuff all the time, but things are intensifying in terms of the radicalism of many quarters, and this is happening on the left, and it's happening on the right. It's happening, and whatever pockets you want to call them, whether left or right, like the amount of like population-wide incredulity and distrust towards everything is intensifying, and with it, a kind of anger and mania. Like the pot is boiling really hot right now, and you don't have any conventional political answers that seem to address this crisis at all. And in fact, they're largely ignoring it.
Right. Part of the crisis that we're in right now is that all of the former ideologies, political philosophies, if you will, that guided society for the last couple hundred years, if not longer, they all were wrecked by COVID. So any sort of centralized, socialistic, the experts know best approach that would be favored by, a certain authoritarian left, you can't trust any of those plans because the experts and the central authorities messed everything up and killed people during COVID. So that's not going to work. But just leaving the market to itself, sort of a laissez-faire liberalism, well, we're seeing corporate actors, monopoly capitalism, particularly the pharmaceutical industry, become predatory. So they're just stripping wealth out of the population by making people sick and taking their money and their retirement and their 401k and that sort of thing. So you can't trust the market to solve this problem. And so where does that leave us? There are no viable theories of state. There are no viable economic philosophies on the table, at least as far as I can see, for how we get out of this crisis. And I feel like that's what Brownstone Institute is working on, is figuring out.
That's why we were founded. And just be clear, the slogan laissez-faire, which was never a good one, by the way. Mises never liked it, for example. Yeah, he always rejected that term because it seems to say, whatever's happening, just let it keep happening. In this case, laissez-faire seems to mean let the corporate cartels pillage everybody forever. With in cooperation with the tech companies, the financial companies, the big banks, the pharmaceutical companies, the media companies that are all playing along with it. I mean, this is the worst. Laissez-faire in this case as a slogan could mean actual civilizational death. So yeah, this is the problem, and we're nowhere near cobbling together a coherent understanding of the way out, because we're not even in any kind of agreement on the problem. So before we just get off into probably we should break that line of thinking out, because it gets too wild, and viewers are saying, no, keep going. But there's all sorts of things about which you're an expert that I feel like I just don't want to miss this occasion to ask you about. Senator Johnson has been tweeting a lot and writing a lot about a paper that was published on vaccination and SIDS that has been out there for some time, that I think you know something about the paper, that has been not just retracted, but actually withdrawn from the journals. Is this? Tell me about that paper, and is this an indication of what you were talking about, that the censorship is growing in the academic press?
Yeah. So we're in the midst of this worldwide digital book burning led by the pharmaceutical industry and their minions, and it's bad right now. So the academic journals, scientific journals, they appear to have, processes for fairness, right? Peer review and editors and proofreaders. And then, if someone is unhappy with an article, well, there's a way to correct articles and improve things over time. That's theoretically how it works. That's not how it works in practice, right? Right now, it's just a mafia. It's just a system for controlling the narrative, putting forward a narrative that will enrich the pharmaceutical industry, and censoring anything that might hurt the profits of the pharmaceutical industry. So they've been hunting critical thinkers for a while, right? So anyone who questioned statins over the last decade or two has seen their careers hurt and papers retracted and blacklisted from universities and think tanks and things like that. You lose your job if you question statins. And that's been going on for a while. But this weaponization of retraction and this weaponization, and to the point where this paper that you're referring to wasn't retracted, it was disappeared, right? It was removed. It was we're going to pretend that this never happened. And the paper was relatively straightforward. The author's a very diligent scholar. The findings were not that surprising, that most SIDS deaths happen in the 2 weeks after vaccination. That's pretty straightforward. If you manipulate a child's immune system at an early age, in a certain percentage of the population, things are going to go sideways, and it's going to manifest as SIDS, it's going to manifest as autism and other developmental disorders. This wasn't a surprising result. There was nothing controversial about this paper. It had been available in the public square for years, but there's sort of this pub peer mafia, which is this sort of not so secretive cabal of people who put a finger on a study and say, we have a concern about this paper. It gives the journal editor the excuse to start a process that has no due process associated with it, and then the paper's made to disappear. But 5 years, 10 years, 15 years, 20 years after the paper has been published, suddenly there's some random person out there in internet land who raises a concern, and now the paper's disappeared. That's not how science works. If we have a disagreement, publish another paper and show the errors in the first paper. We can have a scientific discussion in this country about data, evidence, what have you, and have disagreements. It's okay to have disagreements, but it's not okay to have disagreements when the fundamental underlying product, vaccines, causes more harms than benefits. Everybody knows this, but it's a industry that generates hundreds of billions of dollars of revenue for the pharmaceutical industry, and it's this vast criminal scheme at this point, and nobody wants to go to jail for having advocated for vaccines. And so what they do instead is they engage in censorship, and the censorship hasn't stopped. So just because Elon Musk owns Twitter, well, that doesn't help us with scientific journals, which are wholly captured by industry at this point. It's the darkest moment in the history of American science and medicine by far,
and maybe in the history of journals. I mean, I've never seen anything like this. I mean, there's always a sort of academia has its own rules, and a lot of it is governed by social pecking orders and conventional thinking. This has been true for a long time. Like, to be a dissident scholar for a very long time has always been dangerous. And my own mentor, Murray Rothbard, got sick of it because he couldn't get any of his stuff published in any conventional journal at some point. Once he stopped obeying all the rules, then he had to start his own journal, and actually made a huge difference there. But this is next level stuff. When you're going back and in a sort of Orwellian way, just erasing research to which there's many citations in the literature. So it actually breaks the sort of biggest chain of the advance of knowledge, like setting it back to 15, 20 years. I mean, that's even a violation of the canons of Whig philosophy.
Yeah, we made fun of the Soviet Union for having science dominated by ideology, right? The whole Lysenko affair, where this sort of peasant farmer had this theory about freezing seeds, and that somehow that would make the crops grow better. And Stalin liked it. It sort of fit his ideology of, well, hardworking people who suffer a lot end up producing better things for society. So he kind of embraced it. And then all the scientists who opposed Lysenkoism got forced out of the Soviet, scientific community and sent off to gulags and all the rest of that. And we're like, wow, the Soviet Union's so backwards, driven by ideology, just terrible. And Thomas Kuhn comes along and says, look, we have this better system here in America, structured scientific revolutions. There's a period of normal science, and then anomalies happen, and then new paradigms emerge, and they replace old paradigms, and it's just this, the gears of American science and medicine are just so much more efficient, and come join us over here because we've got this stuff figured out. Well, now, a few decades later, it turns out we have this sort of weird corporate American version of Lysenkoism, where you have to believe in the pharmaceutical industry, you have to believe in vaccines against all evidence to the contrary. You can never question it whatsoever. It fits a dominant ideology. It enriches certain parties and people with financial conflicts of interest that number in the millions. And anybody who fails to participate in believing in the thing, in believing in the great savior of American Lysenkoism, vaccines, is exiled, censored, sent to the, whatever the equivalent of the gulag is in America, where you can't work in the university, you can't be on TV, you can't participate in mainstream science and medical societies. We just have Lysenkoism going on here, but we just call it whatever we call it. We call it modernity. We call it safe and effective. We call it the science, and it's preposterous. We live in an era of preposterous junk science in the United States.
It is so interesting too that you're taking us back to the great Cold War binary. We're good and free and truthful and honest and godly. They're godless, lying, totalitarian, and awful. So they fell apart, and we were all invited to think, well, this is what we always wanted. The good guys have won. So as a result, you sort of let down your guard, and then sure enough, over the decades, look what's happened to us. We've got the very disaster that would have. By the way, I should point out, we are speaking just a couple of days before the 250th anniversary of America's founding, with that glorious, I think, mighty, thrilling document, the Declaration of Independence. And we're all trying to reflect on what it means, and then invited to compare the world in which we live now, where we're seeing so much of what we've spoken about in this conversation just being turned on its head, and sort of brutal and terrible ways. And it's hard to face. It's hard for this country to come to terms that we can't even get the national media to admit the truth about what's happened over the last 5 years. Even when they're reporting on the ill health, the deaths, the rising cancers, the health catastrophe we face in this country, they're still unwilling to talk about what everybody knows and what everybody understands. It must drive you nuts even to read the national press at this point.
Yeah, we are on the verge. The size of the crisis is so enormous, of the state in coordination with monopoly capitalism, poisoning the population, profiting from our misery. The size of the crisis is so enormous that we're on the verge of the collapse of the republic, and quite literally civilizational collapse throughout the developed world. We spent the last 250 years developing the greatest engine for economic growth and prosperity in human history. And now we're on the verge of squandering all of that because certain predatory industries have decided that their wealth and that their hoarding of total resources is more important than the republic, than Western civilization, than the survival of humanity. It's just beyond anything that we have a vocabulary to describe. And so quite literally, people like me reach back for biblical stories and biblical metaphors. I mean, King Herod killing all the boys 2 years and younger. Well, the state feared the political power from below. How different is that from the CDC's vaccine schedule that targets children 2 and below? A lot of shots after that too, but the net effect of that is to keep the working class, the middle class, poor people so sick that they can't rise up and overthrow the system. How different is that from King Herod? How different is our fight now from fighting Pharaoh? How different is our fight now from fighting the Roman Empire and fighting to be free and to be able to practice our beliefs free from the meddling of empire? It's just, I reach back for these older examples because everything about our current era violates the norms of civilization and decency that we've come to expect over the last couple hundred years.
And how different are we from the Aztec Empire, which presumably lived on the idea of human sacrifice to the gods?
Exactly. In fact, if you look at 3,000 SIDS deaths a year in the United States, most of those preventable if we stop giving so many shots during pregnancy in the first year of life. I'm sure that exceeds the number of children sacrificed in an average year by the Aztecs and the Maya. So we think that we're modern, and we're not. Our civilization is savage and barbaric in ways that I never even was willing to contemplate before, but here we are.
Toby, I guess that's what we'll call it. The conventional way to end a podcast like this was to say, well, let's talk about the elements of hope out there. We're not going to try to manipulate our listeners with that kind of gibberish. We're just going to leave it there. But I will say this podcast, of anything I think I've ever done in the post-COVID era, is going to challenge the YouTube censors like nothing else. We'll see if this makes it through.
We shall see.
Yeah, we shall see. Thank you, Toby, for your bravery and for your erudition, for your research, for the glorious science you've done, and which I didn't even advertise at the beginning. But you have the most downloaded dissertation among probably in 21st century political economy. It's called The Political Economy of Autism, and it's still there. You're working at your Substack, every day. I'm so thrilled to have you as a colleague at Brownstone Institute. And you're helping to build this institution as a sort of a refuge from the disasters all around us. And so I want to thank you for that. And thank you so much for joining us today.
Well, thank you, Jeffrey. I'm so grateful for your work, your courage, and the fact that you created a sanctuary for dissident scholars during the darkest era in American history, and the work that you're doing, the work that our fellow colleagues in Brownstone are doing right now. It's incredible. But we've got our work cut out for us. The challenge ahead is to figure out a way out of this valley of death and despair and back to a sane economy once again. And that's sacred work, and it's important work. And I'm so grateful to work alongside you in this task.
Thank you so much, Toby. All the best.